Welcome to my channel. My name is Debbie.
I'm her boyfriend Brian.
And welcome to my BBL journey. So we are on the way to my pre-op appointment. I'm a little nervous. I don't know why, it's just a pre-op appointment. But can we get some coffee first?
No. We're gonna be late.
So we're gonna go get some coffee first, and then we'll see you guys at the doctor's office.
She's so nervous.
I'm so nervous, I'm just chugging my coffee.
So am I. Just going over the final paperwork. Waiting room.
It's gonna be in here, and then
So good.
Okay, so this is what I look like at my pre-op appointment. A little pimple back there, pimple rump. And then they asked me to go ahead and get dressed in this gown, so that's what I'm gonna do now.
And I'll videotape her undressing into the gown.
Yeah, turn it off.
This is a new line from Gucci. Mm-hmm. Yeah. No, we're just waiting for the doctor to come in.
I'll put him next, though.
Dun, dun,
I don't
dun.
know what to do with my
Sit on the bed.
I need to sit on the bed.
Sit right there.
Here is what I look like today. It's not that cute. That's what we're working with. This is what we are trying to fix. Maybe I need a boob job too. What you guys think? Oops, I ripped it again.
This is the little room.
I've got your medicines here, and you can get these filled at any pharmacy.
Okay.
The first is Percocet. Yeah, that's the pain medicine. It's a strong pain medicine, so just take one Percocet every 6 hours for pain. Okay. You can even cut it in half if it's strong. You can use a half a Percocet.
Okay.
And if it's too strong, you can even go down to plain Tylenol. But
Okay.
if you take Tylenol, don't take Percocet at the same time, because Percocet has Tylenol in it. So Percocet or Tylenol, not both together.
Okay.
The next medicine is ondansetron. That's for nausea. Sometimes patients will get a little nauseated that first 12 to 24 hours after surgery. If you get home and your stomach feels upset, take an ondansetron. It'll help settle your tummy.
Okay. And do you mind if we record?
You're allowed to record.
Perfect.
Sure.
Okay, cool.
We just want to document everything and
Absolutely, absolutely. The third medicine is Valium. That's an anti-anxiety medicine. So if you're
Perfect.
nervous the night before the surgery, take a Valium, it'll help you sleep.
Okay.
If you're nervous the morning of the surgery before you come in, you can take another Valium, but just take it with a small sip of water, not a big glass, because we don't want you to have a big glass of water right before the surgery.
Okay.
And if you're taking a Valium, I want you doing the driving, not her.
Oh yeah, perfect.
Okay?
Yeah, I do the driving anyways.
Okay, good, good. So, and bring old, comfortable clothes with you to the surgery, something that's easy to slip on and slip off. You know, slip on, slip off shoes so that you're not having to bend over and tie your shoes.
Okay.
At home, it is important to get up and go to the bathroom and walk around a little bit. A lot of times people think, well, gee, I've had a surgery, I better lie in bed all day. Nothing could be further from the truth. I do want you up and moving around a little bit. Now, you know, you don't have to take a long hike or anything, but even getting up 2 or 3 times a day will help pump blood in your legs. And what I tell patients, even when you're in bed, I want you wiggling your knees, wiggling your ankles like that. That'll help pump blood through the legs and help prevent blood clots.
Okay.
We'll send you home with some intermittent compression boots. When you're in bed, I want you to have those boots on. That again helps pump blood in the legs, helps prevent blood clots from forming.
So is that the one? Are those like socks, or is that something you plug in?
It's actually it has a little battery.
Yeah, it's a pump, right?
It's a pump.
Yeah.
Okay.
Yeah. So it's an air pump.
Okay.
Yeah.
And do you advise me to buy the compression socks?
Well, we're going to have you know, a compression garment. So we'll
Oh.
but the pump that we send you home with, it'll be fine.
Okay.
So you don't have to get anything special other than what we'll provide.
Okay. And then I did have a few questions about the garment. What size? Like, I want to buy an extra pair just so we can, if I'm changing.
To be honest with you, I'm not sure. So, and again, different companies, their sizes are different. So an extra large in one size might be different in another. But we'll provide you with the first garment. Other than, I would like you to bring a sports bra with you.
Okay.
So get a sports bra that clips in the front, something that fits your circumference now.
Okay. And then how about the arms and then the chin strap?
Yeah, the arm, we'll provide the chin strap. We'll provide ace wraps and things for the arms. So you don't need to get stuff for that.
Okay. And then, so when I come in the morning of, should I be wearing what, you guys are going to dress me, right?
Yeah, we'll dress you out. I mean, if you want to switch and change into something different, I've had patients go home in pajamas. If you want to go home in pajamas, you can.
Okay.
But if you want to go home at the same stuff you wore, that's okay. Just as long as it's comfortable, it's easy to slip on and slip off.
Okay.
You know, leave the jewelry at home. Don't put any makeup on because we'll mess up makeup.
I told her that.
Yeah.
I know one of the bigger risks is going under the muscle, hitting a blood vessel. I think you said last time you don't go under the muscle at all?
No, we avoid that. Yeah.
Okay, and then are there any like precautions that you take or like tools that you use to kind of make sure that you're not anywhere near?
Yeah, there's not a tool per se, but when we pass our cannula, we want the cannula tip to be parallel to your overlying skin, and we can feel it as it's going through. So you want to make sure you're parallel with the skin, that you're not poking, you know, 45 degrees or 90 degrees opposed to the skin, that once you're right through the skin, that you're traveling, you know, a parallel to the skin and not going deep, number one.
So you're going like right under the skin then?
Yeah, I mean, you know, the subcutaneous fat in the butt, you know, is probably, an inch or so thick. So we're in that plane. You don't want to be poking down deep into the butt.
Yeah.
And it's hard. There's a layer of connective tissue on top of the muscle called the deep fascia, and it's pretty tough to poke through. And we also use larger blunt tip cannulas so that, you know, it's not like a needle
avoid,
that can easily poke through.
Yeah.
I mean,
so you'll feel, exactly.
Feel it, yeah. So, but it's done by feel.
Okay.
And then we went over the faja size. I was looking at the garments, and there's some that have like the
some patients will put in a full upper body garment. Sometimes for patients like yourself, it might be a little bit more comfortable with just a sports bra and just an ace wrap on the arms. It gives you more freedom of movement, and it's not so hot. So again, we'll see, but I'll probably put you in just ace wraps and a sports bra.
Okay, and then I know I have to wear the garment for basically forever.
No.
Not forever, but like for a really long time.
The first 4 to 6 weeks, I want you to wear it. You know, especially the first 3 weeks, I want you to wear it pretty much 24/7.
Yeah.
Other you can take it off to get in the shower. You can take it off to go to the bathroom. But the more you wear it, the less swelling you're going to have, and it also helps shape you too. So it does pay to keep the garment on. The one we give you is gonna, the one we give you is pretty industrial strength, so after a couple of weeks, if you wanna switch to like a Spanx, you could switch to a Spanx, but just make sure if you get a Spanx, it covers the areas that we liposuctioned.
Okay. So with the arms, do I need to have them bandaged just as much as?
So especially that first couple of weeks, I do want you to keep the bandages on. Again, when you get in the shower, you can take them off, soap and water over your arms and everything. But when you get out of the shower, then put them back on.
Okay, and that's just regular bandages that you.
Yeah, it's a regular ACE. You can get the stretch bandage over the counter, but we'll provide you with the initial ones.
Okay. How about foam boards and ab boards?
Yeah, I do sometimes put a little foam on the front of the tummy. You don't have to go out and buy fancy, but I had my last patient went out and God only knows how much money she spent on foam boards and backboards and all. To be honest, you don't need to do that. I'll provide the foam if we need to cover an area with foam.
Okay. I was thinking. Massages. I think the last time we spoke, you said.
Yeah, again, it pays to do some massaging. You know, not the first week after surgery, but after that first week when you're comfortable, you can start doing a little self massage. Do you have to go out and spend $1,000, you know, getting a lymphatic massage by a professional? You don't.
No.
But you know, if hubby wants to help give you a little massage, by just gently massaging the area, it can help break up bruising and swelling and bleeding and mobilize fluids. So
without any lotions or anything, right?
No, you can use lotion.
Okay.
In fact, there'll be a moisturizer I'll want her to get that'll help with the skin as well. So, you know, while you're putting the moisturizer on, you can do some gentle massage.
Okay.
Sure.
And then I've seen the videos where they are doing the lymphatic massage.
Mhm.
So is I know that the purpose of it is to get everything moving,
Mhm.
but is it also to like drain everything out?
Yeah, when they say lymphatic massage, they're basically saying they're trying to push the lymphatic fluid to get it out of the area where it's swollen and get it back into your circulatory system.
Okay.
But again, any kind of compression, any kind of gentle massage will help that.
And they don't reopen the incisions or anything to do that, right?
No,
Okay.
no, my goodness.
Because we've seen a video where.
It was like squirting out, like she went
well,
the next day.
Okay,
and
well,
pushing it out.
I wouldn't do that. That's a little brutal. You don't need to do that. Again, if there's a fluid buildup, the incisions are tiny. I put one little stitch in the incision. If there's a fluid buildup in a few days, and I think, you know, we need to open up the incision to allow the fluid to go out, I'll do that. But that's you know, one in 50 patients. The vast majority, we just let the incision heal. And I don't want you to be doing massage so severely that it's, you know, causing, you know, fluid to squirt out of you.
Yeah.
So I don't have to squirt any liquids out. I just let it come out naturally.
Let's put it this way, 95% of my patients, 98% of my patients don't have to do that.
Okay.
And if you do, I'll do that. I'm not going to let somebody else do that.
Yeah, I've seen so many videos and they're like, okay, it's my massage day, and it's like,
Yeah,
dripping down the leg.
We've been trying to prepare
Again,
so much.
That first couple of days, I put one little stitch in each incision just to help bring the skin together. I don't make it so it's super tight. So again, if you have a little bit of fluid or a little bleeding or whatever, it allows the fluid to go out. So that first day or two, you may have a little bit of leakage from those drain holes. And I tell patients, just get, you know, a gauze and put it over the area just so you don't have it draining all over the place. But after 24, 48 hours, usually that'll cease. Yeah.
And then the fluid will kind of just.
Yeah, but I'm not going to have you do any massage for at least the first week after the surgery.
Okay. Okay. That was actually the other questions. Pads and gauze for the incisions. So I can do that. Arnica.
Yeah, so some patients will use arnica, and you can get that over the counter. You don't need a prescription for it, and that can help to some extent with bruising.
And swelling as well.
Yep.
So that's for breathing and swelling?
Yep.
Okay.
And then how much fat do you normally transfer? Like what's...
It depends on the patient. I've done Brazilian butt lifts where we've removed just a couple of hundred cc, or put in just a couple of hundred cc's in each butt. I've done ones where we put 1,800 cc's in each butt. You're not going to be a 200 cc butt. You're not going to be an 1,800 cc butt. But I imagine it'll probably be in the, you know, somewhere around 700 to 1,000, maybe 1,200 in that range.
Combined, right?
Each butt.
Oh, okay.
And that's a safe amount. Like, is there...
Yeah. Again, any surgery carries risks, and
Yeah.
certainly this surgery. Again, you know about the pulmonary emboli. That's the big risk we worry about. So, You know, number one, I expect you have some swelling in your arms and legs after the surgery, but if you get out several days and all of a sudden you have a swollen leg that wasn't swollen the day before, or pain in a leg where I didn't operate on you, don't ignore it. Let me know about it. Or shortness of breath. Again, don't ignore it. You know, let me know about it immediately. Or if there's some reason you can't get a hold of me, it's almost always you can. You know, then seek immediate medical attention. Don't just sit at home and say, "Oh my gosh, she's not breathing right. We're going to just wait." Yeah.
I think that's all the questions I have. Do you have any more questions?
I just, you guys are gonna give me the aftercare stuff, right?
Oh yeah.
Okay.
So the nurses will go. And again, if there's any question, you give me a call. I'm available. The phone exchange rings through to our exchange 24/7. I carry a pager. I carry a cell phone, and they can get me by my pager, by my cell phone, or I'm at home.
Perfect.
And I've got two partners now, Dr. Mazer, who now helps me, and Dr. Bates is going to be coming on next week.
Yeah, that's what you said last time that you were bringing. Yeah.
Yeah, two guys on. So one of us is always going to be available.
Okay.
And it won't be just you performing the surgery?
Yeah, it's me. It's little old me. Yeah.
Okay.
Yes, we do like when we have bigger surgeries where there's a lot of sewing. I'll work with Dr. Mazer, or I'll work with Dr. Bates to make the surgery go faster. Unfortunately, with this, the incisions are tiny. It's one stitch, so it's really just the liposuctioning and the fat injection, and really that's best done by just one doctor. Good. And then one facing the wall that way. And I'm going to just have you unbutton your bra.
Okay.
There you go. That's good.
Do you want me to move my hair?
You're fine. There we go.
Okay guys, I'm back. So after we stopped filming, we went into the office with one of the ladies. She went through everything. She made sure that I stopped smoking, that I stopped taking my birth control, that I completed my physical. She went through all of my blood work. After that, she kind of explained what's gonna go on surgery day, that I have to come in comfortable clothes, something that you can just put on and button or zip in the front. I can't wear any makeup, no jewelry, no piercings, and that I have to bring my meds that day. After that was done, I basically just signed consent forms and I made my payment. Today is June 26th and my surgery is in exactly 2 weeks from today. I'm so excited. I'm so nervous. I don't know what to feel. I think that's normal, but I don't know. I don't know what to do with myself sometimes. Like, sometimes I get into my head and I start thinking like all the negatives, or like, do I really want to do this? Obviously, I can't turn back now. I already completed payment and, you know, we booked the day and everything. I don't think I would get my money back if I changed my mind. But we'll see how this goes. I've got God on my side, so everything will go good. Thanks for watching my video. If you liked it, please give me a thumbs up. Don't forget to subscribe and hit that bell so you know when I post the next video. Until next time, bye.